This last year, we had a number of summaries. It's actually been in the last 3 years that we've had 2 niacin trials fail to add benefit combination of statin with niacin. So niacin's pretty much not necessary anymore unless you have a completely statin intolerant subject, and then you could use it. Or if you have hypertriglyceridemia, we still use it. So it's not completely useless, but and then the CETP inhibitors early failed, but we have 2 that are in phase 3 clinical trials now. Maybe those trials will be positive, and then and those again are the HDL drugs. They lower LDL also, but they mostly are HDL raising drugs. And then there are 2 polyunsaturated fatty acid, other name fish oil trials that are ongoing, and relatively small trials, kind of brave trials, but hoping that they will demonstrate some efficacy for event reduction. The problem with fish oils right now is that, you know, many over-the-counter fish oil preparations are available, and the average person or patient doesn't understand that they're completely unregulated and could have anything in them. Recent New York Times, nothing. You have the average physician or cardiologist saying, well, why would I prescribe them? There aren't any positive trials. Why would I use the prescription grade? Why would I, you know, and none of them are off patent, so they're more expensive. So 2 fish oil trials are ongoing. I think the guidelines are still relatively new, and we are working through in this end of first year to understand how people are or are not adopting them. So I think that's true. I think that there are new strategies because new drugs are coming, but they're not here yet. I mean, we've converted heart disease into a chronic management. It's why we have this burden of cardiovascular disease now. We don't let anyone die, so we get to continue to help them manage. And it's interesting because there have been some recent data, sort of, you know, we have this patient-centered research institute now at PCORI, and we have data coming out of PCORI now that says pretty loud and clear, patients don't want to take pills. And even if they're adequately informed, they understand the message, they're literate, they get it, they take the test, they understand that if you don't take this pill, you will have a shorter life, you will have more pain and suffering. A majority of people still say they don't want to take the pill. So it's an interesting, that's been a real eye-opener, I think. Certainly I speak for myself. We work really hard at all this. And the folks that see us regularly in clinic, and they get good advisement from a cardiovascular specialist or a good primary care who's really paying attention. They are prescribed the right medications, and they are monitored regularly. This is completely manageable. You'll die of something else. And yet we have that public, it's not even a public perception, it's a public, that's what they want. They don't want to take pills.